From the business of food and irresistible summer treats to weight loss options, dieting is big business in the United States. The struggle to keep weight off has kept researchers at Washington University busy with patients. Soon, they hope their latest findings join a mounting list of non-surgical options for treating obesity. HEC-TV's Victoria Babu has more on this ballooning innovation.
Sophie, you gonna come?
32-year-old Lisa Whealon is a changed person. In 1 year, she has gone from obese, slow, and sluggish to fit, trim, and energized.
But I knew that something needed to change because the fad diets I was on wasn't working.
Like the 2/3 of Americans who are overweight or obese, the St. Louis mother has gained and lost the same 25 pounds for years.
Lisa, what was your trigger, that moment when you said, I've got to get extra help?
You know, after I had my second daughter, it was hard to run around and play. It was hard to just be the mom that I wanted to be. It was a task just to go up and down the stairs with a laundry basket, and going to the zoo for the day to do all of that walking seemed exhausting.
Lisa had high hopes after attending an informational meeting at Washington University School of Medicine. Doctors were looking for overweight but healthy candidates to participate in a study for a new weight loss procedure involving 3 balloons rather than the current 2 approved by the FDA.
It at least seems that a lot of those good, positive, behavior changes that you made during the trial, it seems like they really have stuck.
The lead researcher is gastroenterologist Dr. Shelby Sullivan. Her goals were to make the procedure less invasive and with fewer side effects.
The difference with this balloon is that it's a swallowable balloon, so that eliminates the need for one procedure and one sedation.
It seemed like the perfect match for me. It wasn't surgery, it wasn't that scary route, but it was a little bit more help than what I was currently doing.
Lisa was one of 387 patients as part of this test study. One group was given sugar pills, the other the actual balloons. The system itself is called Obalon, where 3 balloons are administered over a period of time.
Unbeknown to Lisa, she was placed in the placebo group.
I'd lost 50 pounds and I was excited that I did that with on my own. I knew I could do it, or I hoped I could do it, so I was glad that I could. But then I'd hit a plateau. You're going to eat the tomatoes. I know how you roll with tomatoes.
Once she plateaued, she was given the 3 nitrogen gas-filled balloons. They were placed several weeks apart to allow her body to adjust. Each time she swallowed a balloon, she did so with the help of a doctor and during her lunch break. The entire process took about 20 minutes.
Not everyone was a candidate for the study. Some had trouble swallowing this capsule, which housed the balloon. Once the capsule was inside, it dissolved and the balloon enlarged.
I think for me, the worst part of the whole procedure was drinking that much warm water that quickly, because you have to kind of chug it to get the balloon to dissolve.
The capsule is connected to a catheter, so you're swallowing that capsule with a catheter connected to it. It hits the stomach. The capsule dissolves off of the balloon. It starts to unfold. We verify placement with both pressure sensing that we have hooked up to the catheter, because the pressure drops in the balloon once it starts to unfold. And then we also take a fluoroscopic image to make sure that fluoroscopically we can actually visually see that it's in the stomach.
We're going to go over what you ate yesterday.
Dr. Sullivan created a nutritional plan and required Lisa and other patients to meet often with registered dietitian Abby Lowe, talking about challenges.
Looking at the things that you need to change is an opportunity to grow rather than a time to really get down on yourself.
And goals.
Even if the device does what it's supposed to do and fill up your stomach and make you feel more full, it's nice to have someone to come and talk to about what you're feeling and trying to understand your satiety signals and your hunger signals, and understanding how much you can eat and feel comfortable, just to have someone to run it past.
Want some water?
Finding those small changes every day, walk a few more steps, find a place you can cut back a couple hundred calories, stuff like that. But if you're not committed to making those little changes, you don't see the success, even with the balloon.
The balloons were removed by placing an endoscope or tube down Lisa's throat 6 months after the first one was placed.
Were there any surprises that came out of this study?
I think there are a couple of things. One is the low side effects.
But a pleasant surprise.
It's a pleasant surprise. we can clearly point to an increase in the rate of weight loss with that third balloon administration.
Side effects can include cramping, nausea, or diarrhea.
The most side effect I ever had was laying in bed at night. Sometimes I could feel them moving.
The volunteers in this study lost about 7% of their body weight after 6 months, which was enough to bring down cholesterol, blood pressure, and blood sugar.
People who come in expecting it just to be a quick fix are disappointed, and they're the ones who tend not to have the same success rate.
Lisa is just a couple of pounds shy of her goal of a 100-pound weight loss, and thanks to her improved habits, she's adjusting well to life without the balloons and maintaining her weight loss, the ultimate goal.
Now I feel like I'm leading the charge, I'm leading the pack almost. When my kids are telling me that they're tired from something that we're doing, I get excited about that because that means that I've worn them out for a change.
Dr. Sullivan is looking for FDA approval of the Obalon 3-balloon system in early 2017. For Innovations, I'm Victoria Babu.